Welcome to this video on viral hepatitis, focusing on community health nursing and communicable diseases. This content is relevant for nursing exams like NORCET, RRB, ESIC, and DHS. Remember that success is the sum of small efforts, repeated day in and day out. Consistency in your efforts will lead to success. Hepatitis is defined as the inflammation of the liver tissue. While it can be caused by alcohol or toxins, viral infections are the most common cause. Viral hepatitis is caused by 5 main viruses: A, B, C, D, and E. It is a major cause of global morbidity and mortality. Viral hepatitis is classified based on its transmission route. The vowels A and E are transmitted via the fecal-oral or enteric route. The consonants B, C, and D are transmitted parenterally or via the blood-borne route. Hepatitis A, also called infectious hepatitis, is an RNA virus transmitted through the fecal-oral route, usually via contaminated food or water. Humans are the reservoir, and cases often peak in autumn and early winter or during floods. The incubation period for hepatitis A is 15 to 45 days. Infectivity is highest 2 weeks before and 1 week after jaundice onset. Symptoms include fever, nausea, loss of appetite, and jaundice. Children under 6 years old are often anapteric, meaning they do not show jaundice. Hepatitis E, an RNA virus, is also transmitted via the fecal-oral route, often through waterborne outbreaks. It primarily affects young adults aged 15 to 40 years. The average incubation period is about 40 days. It poses a critical risk, especially for pregnant women. To quickly review hepatitis A and E, both are transmitted via the fecal-oral route and are enteric. Hepatitis E is known to be fatal for pregnant women, and hepatitis A does not have a chronic carrier state. Hepatitis B, often called the silent killer, is unique as it is the only DNA virus causing hepatitis. It is highly resistant and can survive on environmental surfaces for 7 days. HBV can lead to chronic hepatitis, cirrhosis, and liver cancer. The structure of the hepatitis B virus is known as the Dane particle. Key antigens include HBs AG, the surface antigen, HBcAg, the core antigen, and HBAg, which indicates active viral replication. HBV is transmitted parenterally through blood products or contaminated instruments, sexually and vertically, from mother to child, which is the most common route in endemic areas. It can also spread horizontally through close household contact. This slide highlights the HBV serological markers, which are central to understanding infection status in exams. This table provides the golden rule for interpreting the various serological markers of hepatitis B to determine the patient's status. According to the National Immunization Schedule, a monovalent hepatitis B birth dose is given intramuscularly within 24 hours of birth. The site is the anterolateral aspect of the mid-thigh. Follow-up doses are given at 6, 10, and 14 weeks as part of the pentavalent vaccine. For post-exposure prophylaxis following a needle stick injury from an HBs AG positive patient, immediately wash the area with soap and water. If the nurse is unvaccinated, give hepatitis B immunoglobulin within 24 hours and start the vaccination series. The correct answer to the corresponding exam question is C, HBeAg. Hepatitis C is an RNA flavivirus, commonly known as post-transfusion hepatitis. A key feature is the high rate of chronicity, with up to 80% becoming chronic carriers. Transmission occurs through blood, IV drug use, and unsafe injections. There is currently no vaccine available for Hep C. Hepatitis C is often asymptomatic and detected years later when cirrhosis or cancer develops. Screening uses anti-HCV antibodies and is confirmed by HCV RNA via PCR. Treatment with direct-acting antivirals offers a high cure rate. Hepatitis D, or Delta agent, is a defective RNA virus. It requires the hepatitis B surface antigen to replicate and cannot exist alone. Therefore, hepatitis B vaccination also prevents hepatitis D infection. Co-infection is the simultaneous infection with HBV and HDV, which usually results in complete recovery. Superinfection is when a chronic HBV carrier later gets HDV, resulting in a very poor prognosis and high risk of severe liver disease. Reviewing B, C, and D, hepatitis B is the only DNA virus. Hepatitis C is known as post-transfusion hepatitis. Anti-HBs indicates immunity from vaccination, and hepatitis D is the dependent virus. This chart compares the primary modes of transmission for all 5 types of viral hepatitis. This slide compares the typical incubation periods for hepatitis A, B, C, D, and E. The risk of chronicity varies greatly: 0 for A and E, high for C at 70 to 80%, and variable for B, depending on the age of infection. Viral hepatitis progresses through 3 clinical stages. The pre-icteric stage involves flu-like symptoms. The icteric stage is marked by the appearance of jaundice, dark urine, and pale stool. Finally, the post-icteric stage is characterized by the fading of jaundice and return of appetite. Complications can include fulminant hepatic failure, especially from hepatitis E in pregnancy or B and D co-infection. Long-term complications are cirrhosis and hepatocellular carcinoma, often linked to chronic hepatitis B and C. Prevention strategies for enteric hepatitis, A and E, focus on safe water and hygiene. Prevention for parenteral hepatitis, B, C, and D includes screening blood, safe injection practices, safe sex, and HBV vaccination. For nurses, universal precautions are vital. Always treat all blood and body fluids as potentially infectious. Maintain strict hand hygiene, use personal protective equipment, and practice sharp safety by never recapping needles. For blood or fluid spill management, cover the area with absorbent material. Disinfect using 1% sodium hypochlorite or bleach with a contact time of 20 minutes before cleaning up. The correct answer to the exam question here is C, no treatment required. The correct answer is D, recombinant DNA. The correct answer is C, immunity due to vaccination. The correct answer is D, hepatitis E. Acute hepatitis treatment is usually supportive, focusing on rest and fluids. Chronic hepatitis B is managed with antivirals like tenofovir, and chronic hepatitis C is treated with DAAs for a potential cure. Always avoid hepatotoxic drugs and alcohol. Nursing care includes promoting bed rest to reduce the liver's metabolic demand. The diet should be high in carbohydrates, moderate in protein, and low in fat if the patient is nauseated. For itching, provide skincare measures like calamine lotion and keeping nails short. Health education is crucial. Promote sanitation and hand washing. Encourage safe sex and advise against sharing personal items like razors and needles. Encourage hepatitis B vaccination and advise against blood donation if there's a history of Hep B or C. The window period marker is IgM anti-HBC. The Hep B birth dose is given within 24 hours. Sodium hypochlorite is the disinfectant for blood, and hepatitis B is the only DNA hepatitis virus. This slide provides a summary cheat sheet of key facts about all 5 hepatitis viruses. Remember, do not watch the clock. Do what it does. Keep going. Your consistency will pay off. Thank you for watching this video. We wish you all the best for your NORCET and RRB exams. You can contact Mr. Nagesh Sir using the information provided on the screen for further guidance.